One of the most effective treatment options we have is physical means of treatment. Now remember, when we went through our options, we talked about doing nothing, further x-rays, and then physical. So this is usually our third option. What happens is I oftentimes talk about, oh, we have physical options for you, and that involves physical therapy. Almost always I get interrupted there. I've already done physical therapy. It made me worse. Okay. Physical therapy, chiropractic, osteopathic, and those are options. And they want to stress to me, I really did try it, or I've tried it several times. The point is, physical therapy still has a role. Physical therapy, chiropractic, osteopathic treatments, anything that are being done physical are just ways of really tapping into your own body's ability to cure itself with some professional help. And so oftentimes when I have patients do physical therapy, I remind them, when you are doing physical therapy with an orthopedic physical therapist, or perhaps an occupational therapist who works with the hand, that's very different than working with a pain physical therapist. The pain physical therapist is going to be focused more on getting range of motion and getting movement going before we try to work and strengthen you. Whereas if you've got a knee problem or a shoulder issue with an orthopedic surgeon, they're going to be working on strengthening. Or if you have a sports injury, it's usually going to be working on strengthening. That's a different thing than what we're doing. And if you work with a common physical therapist that is trained in orthopedic or neural issues, they're going to probably do that, and you'll probably get worse. This isn't complaining about them. This isn't saying they're wrong. It's just saying it's the wrong treatment. And so working with a pain physical therapist who can work with you at getting range of motion going, and then as you got the joint moving more, the muscle moving more, then you can work on strengthening it often. And here's the thing. Oftentimes in physical therapy, it doesn't fix you because you can't be fixed. Sometimes it just strengthens you. Sometimes it just slows down the progression of your normal condition. As you know, as you age, things get worse. And one of the goals in physical therapy is, can we slow down that progression from this point to that point? Maybe we can make it so it's not like this. Maybe it's just a little bit less. And that's oftentimes difficult to judge. They'll say, I did therapy and I don't feel better. Well, you may not feel better, but at least you're getting worse slower. And that's one of the keys. The other thing is, oftentimes when we're working with you and we're using various medications, I kind of want to see a little effort. I want to kind of see that you're putting something into it, and that's your chance to do that in physical therapy. Now, not all physical therapy has to happen in a gym. Good physical therapists will work with you and do things with you, but they will also instruct you. They'll also guide you and show you and even work with the things that you like to do so you can continue your therapy at home. And you can continue your therapy on days that you don't come into the gym. And that even when they're done with you in physical therapy and they've discharged you or graduated you, you can still maintain. You know, it may be that later we'll have to re-begin therapy and get you to another level. So maybe you get to a level and kind of plateau out, then after a while, then you can go to a higher level. There's always going to be a role for the physical treatments. And the physical therapists, the chiropractors, the osteopathic physicians, all has something to add. And I think taking an active approach towards your pain condition is the best approach. It might be that we do several things. Maybe we'll be doing medications and the injections with the physical approach. In fact, the truth is, the most effective thing about the injections we do is it allows you to do better in therapy. And so it's really the physical therapy that's healing you more than it is my injections. So overall, I think that keep an open mind to physical therapy. Keep in mind you do have a youthfulness within you that is wanting to improve, that is wanting to get movement. And the main term in the end usually is motion is lotion. If you can get it moving, if you can keep it moving, it tends to do better than if it's just sitting around getting fat and flabby. So overall, physical therapy has a role. Keep that in mind. Thank you.